Now, guys, before I do discussion B, I'm going to remind you that we may do a live chat during or after the show. So if anybody has any questions or comments about what I'm doing, about the topic I'm doing tonight, we may do question and answer session in the middle of the show or after. Okay, so here we go. The article highlights a central tension in aging and healthcare. While most older adults overwhelmingly want to remain in their own homes, doing so safely requires dependable home care. Yet the home care sector is buckling under the weight of the rising demand and deepening labor shortages. This mismatch between preferences and capacity has created what experts call a crisis, a system that is not working well for patients, families, or workers. Why this is a quandary. Remaining at home often means juggling multiple layers of support: family caregivers, paid aides, visiting nurses, or community services. When these supports falter, older adults may struggle with basic but essential tasks: managing complex medications, regimens, preparing meals, bathing, dressing, or simply moving safely around the house without reliable help. Risks multiply: falls, malnutrition, hospital readmissions, or social isolation. Institutional care facilities exist, but surveys consistently show that most people want to avoid them. Preferring the familiarity and dignity of home. This leaves families caught between honoring those wishes and confronting the practical difficulties of arranging safe, sustainable care. How big the problem is. The scale of the challenge is shrinking. Home care has become one of the fastest growing occupations in the United States. In 2024, there were about 3.2 million home health aides and personal care aides, more than double the 1.4 million employed just a decade earlier. Despite this growth, Demand continues to outpace supply. Employers report difficulty recruiting and retaining workers, in part because wages remain low and the work is physically and emotionally demanding. The result is a revolving door of caregivers, leaving patients and their families without continuity of care. Experts quoted in the article stress that this is not a distant problem, but an urgent one unfolding in communities across the country. What's driving change where hope exists? Against this grim backdrop, some promising alternatives are emerging. New models seek to professionalize home care work by offering better pay, training, and career pathways, which could help stabilize the workforce. Policy initiatives are exploring ways to integrate home care more fully into the healthcare system, ensuring that aides are recognized as vital members of care teams rather than peripheral support. Innovations in technology, such as remote monitoring, medication management tools, and telehealth, may also ease the burden on caregivers while improving safety. For patients, these shifts, though still in early stages, suggest that the sector can evolve to meet both the needs of aging adults and their aspirations of workers. Critical implications for families and policymakers. For families, the reality is that arranging safe home care may require a patchwork approach, combining informal help from relatives or neighbors with paid services, and often navigating a confusing landscape of agencies, insurance, coverage, and out of pocket costs. Policymakers and health systems face a clear mandate: invest in the home care workforce, improve compensation and working conditions, and supportive, innovative care models. Doing so would only would not only honor the wishes of older adults to age in place, but also reintroduce, reduce strain on hospitals and nursing homes, ultimately solving the home care quandary, means reimagining care as a shared responsibility, one that values dignity, safety, and sustainability for patients, families, and the workers who make aging at home possible. Okay, guys, I'll be back on with C shortly. Give me a bit to put that together, please, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.